Traditional ways of treating the basket of disorders known as heart conditions are being replaced by less invasive and more technology-driven therapies. 25 years ago, a patient with coronary artery disease, as shown here, would almost invariably be a candidate for coronary artery bypass surgery. The so-called CABG was a highly invasive procedure involving opening the chest cavity and grafting in a vein taken from elsewhere in the body. While the procedure still exists today, it's by no means the only option for many patients. Nowadays, the interventional cardiologist has an array of devices at his or her disposal, and that applies for all aspects of heart disease. From angioplasty balloons, atherectomy devices and stents, an array of devices exists to reopen and keep coronary arteries patent. Stents come in many forms, starting with the original bare metal variety, which was designed simply to open in the desired position and act as a scaffold to hold the lumen open. Next came the drug-eluting stent, originally a bare metal scaffold which was coated with a polymer which in turn carried a drug that prevented cellular build-up around the stent. And now we see stents appearing that are both drug-eluting and resorbable. They do their job of opening the vessel. They protect against the cellular proliferation, so-called neo-intimal hyperplasia, and then, as shown here, they dissolve, leaving no permanent implant behind in the vessel. It's the same story in heart valve replacement. While the optimal means of implanting an aortic valve may still be to stitch a new one onto the site of the degenerating valve, new devices are coming onto the market that can be inserted in what is called transcatheter fashion, which means minimally invasively. Transcatheter aortic valve implantation, or TAVI, is already widespread in Europe and is in limited clinical use in the United States. The technology allows patients who are too sick to undergo major surgery to have their aortic valve replaced, which can obviously be a lifesaver. These are just two examples of the incredible pace of development in recent years. The same could be said in treatment of cardiac arrhythmia, with devices to identify, analyze and correct the faulty electrical impulses driving rhythm disorders such as atrial fibrillation. In heart pacing, defibrillation, blood pressure reduction or heart function monitoring, the pace of development is not showing any sign of slowing. Cardio Device News is here to keep you up to date with the latest technologies.